Before we start, I would like to introduce you to our extraordinarily varied group representing pretty much all types of healthcare stakeholders. This is sort of at the core of this panel to make sure that we connect the dots from different angles and different agendas. Starting to my right, Natalia Ciobanu is a director at Thinked and also is a great proponent of both the circular economy as well as all things ESG, environment, society, and governance. And Natalia, we are very happy to have you. You're coming from Romania, so we will also be trying to get some perspective both from your country as well as big perspective across Europe. We're also extremely proud to have José Luis Castro, who is the Special Envoy from Director General Special Envoy from WHO, covering respiratory diseases and, by that token, pollution. I'll stop here briefly because that is precisely the intersection of environment and healthcare that we will be exploring today. Sometimes a mystifying boundary for many, but in reality, a causal link between the environment and healthcare. We also have our local expert and local ambassador of ESG and circular economy, Agnieszka Schneck, director of Innovo. Probably doesn't need much introduction. Agnieszka works not only in Poland as an ambassador of green hospitals, but also at European level as an advisor to the European Commission. And following Agnieszka, we have David Kolarz, who represents the industry in the broadest possible sense. I believe it's probably easier to say that David represents more than industry because he also represents patients who are very much connected with his organization, which is called AIFP. It's an organization of innovative pharma companies. Joining us from Czechia, David Kolarz. Next person we have is Georgi Mesaros. I always get confused, the SZ being the opposite in Polish, but Georgi Mesaros is really going to have a pivotal role for this panel as he represents the patient voice, the patient perspective, again, working very internationally, but also working in Hungary, which is quite a challenging place to be when it comes to healthcare. And finally, Professor Zielonka, Professor Tadeusz Zielonka, again, probably needs no introduction in Poland, but for the benefit of this panel, it is now being streamed internationally. Professor Zielonka is a pulmonologist, is an internist. Professor Zielonka is also probably one of the very few outspoken proponents and ambassadors of ESG in healthcare, something that not many have done so far.
I concluded my newsletter by saying that, that climate action is also health action, because the effects of the climate are something that, as our Director General has observed, is happening now. It's not something that will happen in the future, and it's affecting people today. And the group of countries in the Central and Eastern Europe region are affected disproportionately the most year after year by the effects of climate change, especially on respiratory diseases. We are seeing also that these diseases are affecting children, and children, as you know, their lungs haven't been fully developed, so they will have a longer and more lasting damage, to their lungs by the effects of pollution. We're also seeing that the WHO quality, guidelines are clear. The safe limit for particles are 5 micrograms per cubic meters. And many Central and Eastern European cities face levels that are 4 to 5 times higher. Now, and just yesterday, the University of Chicago released the Air Quality Life Index, or AQLI, in which the data shows that air pollution is cutting years of life expectancy around the world. A stark reminder of what's at stake in this region and elsewhere. So if we have a message for policy makers, is one is to cut air pollution at the source. Phase out coal and dirty fuels, clean up transport and industry, and tackle also farm emissions, align the national air quality standards with WHO guidelines and also with the EU 2030 limits. I think these are all concrete steps that can be taken to address the issue.
Mam bardzo świeże badania, które pochodzą sprzed paru miesięcy, które oceniały świadomość śladu węglowego u studentów medycyny kończących studia w Warszawskim Uniwersytecie Medycznym. Co się okazało? Mamy świetną młodzież. Oni są bardzo proekologiczni. 80% dla nich ekologia to jest niezwykle ważna rzecz. Bardzo dobre wyniki. Proszę Państwa, sprawdziłem wiedzę na temat śladu węglowego leków. Praktycznie zerowa, od 2 do 4%. Czyli oni bardzo by chcieli być ekologiczni, ale oni kończąc studia nie dostali żadnej wiedzy na ten temat. Skutki zanieczyszczeń powietrza, skutki klimatycznych zmian, to my będziemy mieli olbrzymi problem, ponieważ my tak naprawdę, ktoś powie edukacja, edukacja. Nie, my nie mamy edukatorów. My powinniśmy zacząć od przygotowania kadry edukatorów, ponieważ mówienie o edukacji bez edukatora nie ma sensu.
What is S&G and how do they work together within the entity, within the business or the facility? We can think of it as a patient, really, as a human body. No? The E is lungs, the liver, the kidneys. It's the metabolism is what my facility, what my company is taking in and metabolizing and letting out. No? Energy, emissions, products we're consuming, waste we're generating. It's about that. The S is about the people. It's the heart at the end of the day. No, it's the heart that beats, that keeps the body alive and all the other organs fed with the blood, right? Supplied with the blood. So it's really, people are at the heart of any entity, of any business, of any activity. And it's about people, meaning the workforce within the entity, within the company, the hospital. It is about the workforce in the supply chain. It wouldn't help me if the workers, for example, of a key supplier of my supplies that I need to use are exploited in their activity and can cause interruptions, and then, right, I'm not able to conduct my own business. So it is also about the workforce in the supply chain. It is very much about the beneficiaries of my activity, the customers, if I'm a company, a producing company, the patients. It's about how they are impacted and how I am impacting them. And it is very much also about the communities where I operate. And the professor said very well, how can I engage in a conversation with the doctors and the patients on these topics if it's not part of the culture in the community where I operate?
Since 2 years, we actually established Green Coalition for Health. This is a Polish initiative platform. We try to gather different stakeholders from healthcare sector, but not only, also from, for example, from construction sector, from medical devices sector, to really bring the knowledge, experience change, and really implement the different sustainable solutions in the healthcare sector. And the truth is that the healthcare specialists, doctors, medical doctors, they don't know much about sustainability. Although the hospital directors, they are more aware at the moment, and actually at the moment we have more than 40 hospitals, public hospitals, private hospitals, which are members of our coalition. And also the directors of the hospitals see the benefit, the economic benefit as well, to implement different sustainable solutions in their premises, in the hospitals, especially regarding energy, for example, waste management, etc. So I see the light in the tunnel, let's say. So already, as I said, we try to also educate them, share the knowledge, and bring more stakeholders to the table to really make a change.
When we look at the initiatives that are ESG or climate-oriented or sustainability-oriented, in some countries like Netherlands, they are not driven by clinicians or policymakers. They are actually driven mostly by patients, and patients who are being listened and empowered to bring in solutions to hospitals. And I think that's potentially also a cultural shift that has already occurred in some countries in Europe. And by the way, in Czechia, we are seeing that shift already, and I'm sure David Kolář will be able to speak volumes about this. So it's not a divide between West and East, but that shift is extremely important. And that brings me to a question to Gergi. You are the patient voice. You work with patients with pulmonary fibrosis, with respiratory, extremely debilitating respiratory diseases. How do you see that involvement of patients in creating more sustainable healthcare systems?
If you ask from a very specific point of view from patients, that actually patient associations are really interested in going green. Some of these initiatives actually nicely harmonized with the global need of patients of being cured, of having better access to healthcare. If you are looking for very specific examples, I'm really happy to deliver some. So we learned from COVID that actually it's very easy to reach out our patients virtually. So many activities of the patient associations are going virtually, which is really decreasing the carbon footprint of how patient organizations are operating. On the other hand, there's also other initiatives how we try to decarbonize the healthcare system. For instance, we can also talk about that initiative which is coming from the European Reference Network for Respiratory Diseases. You might know that many rare disease patients are treated in expert centers, which are regional ones very far from their living address. And the ERL Lung initiative is about building up satellite system, which means that there might be huge expert centers in big cities, but not all these rare disease patients should be treated in these centers, but only the very complicated ones. So some regional hospitals might be nominated as satellite centers, so the patient should not travel 8 or 10 hours to visit an expert for a very small or even not invasive tests. So I think that we have a lot of things to do. As I mentioned in the very first part of my talk, patients are the best tool for advocate for going green. We are the best ones who heard by decision makers and policy makers. And as we talk with José Luis, we can also bring a little bit sense of humanity as being part of a patient community and not only delivering very dry data which might be landed in the drawer.
Yeah, that was the reason why we established the ESG platform. It was in Czech Republic mainly driven by Chiesi, because I still think that Chiesi is one of the unicorns, even amongst the innovative pharma companies, who is really going ahead to that topic. We collected what is currently being done on the level of the innovative companies, because a lot of that is really happening already. Maybe not everybody is aware that it is part of ESG, but let's say the industrial mission and what we are doing, even our business is core S in ESG, because we are bringing the innovative treatment to the patients. So we are part of ESG. And now we collected what is already happening in those companies active in Czech Republic. It's a lot of activities already there, mainly in that S part. And now we are thinking how to promote it and how to start the discussion with the government, because if you would like to really, and coming back to the Europe, if you would like to implement ESG broadly, we need to think about that in a complex way. Because, for example, last European legislations which are touching those areas, like Urban Wastewater Treatment Directive or General Pharma legislation, even Critical Medicines Act, they are bringing good ideas, but they are thinking only about that particular part they are covering. So if we are really bringing the new obligation for the innovative pharma companies and all pharma companies and the cosmetics companies to pay for the water management treatment, it's fine, okay, but we need to think about what is the impact on the companies, and if they are not pushed to cut another expenses or another investments they are doing, for example, in the ESG part, which is somehow still voluntary in those parts and not obligatory like it is.
One of the biggest challenges is the lack of information about the impact of the healthcare system on the environment, and I think that beginning, first of all, in sharing that information and also in training physicians and ensuring that governments, for example, or even industry, include those into their procurement system, into their clinical trials, into their different activities, begins that road to a greener pathway to care. But I think it all begins with the information and what the impact is, to know exactly what the appropriate intervention is. There are, of course, initiatives on green procurement, such as in Sweden, net zero in Belgium, and I think also in the UK. I mean, these are all initiatives that have, they're proven initiatives that reduce the carbon footprint. But what is always important in understanding whether the initiative will have a positive impact is to understand what the problem that you're trying to solve is, and to have appropriate data and also an appropriate method of educating the users in the population on how this will be applied and how it will benefit them.
Lekarze muszą się kształcić. Lekarzom się przestaje kształcić, ponieważ jest tak duże zapotrzebowanie na ich pracę, że zanika problem ciągłej edukacji i nie ma systemu nadzoru. A to jest kolejny interesariusz, który ma nadzorować, czy leczenie jest zgodne nie tylko z zasadami sztuki, nie tylko opłacalne, ale czy jest dobre dla środowiska. Ten element również musi w nadzorze zaistnieć. Teraz firmy farmaceutyczne. Jedni mówią, przedłużmy termin obowiązywania poprawki z Kigali, od kiedy ona ma wejść w życie. Przecież ona jest już od 15 prawie lat, od 10 lat, od 10 lat obowiązuje. Jedni pracują nad nowymi, tu Chiesi padło, tak, oni ten czas wykorzystali do przygotowania nowego produktu, a inni czekają, że nam przedłużą, bo przecież nie wstrzymają leków. To jest świetny przykład, że wszyscy mają tu coś do zrobienia, przemysł farmaceutyczny też. Ja pamiętam, jak rozdzielano szaty, gdy był protokół montrealski w sprawie dziury ozonowej. Mówiono, zabiorą leki ratujące życie. Nic się takiego nie stało. Każdy interesariusz, który jest w służbie zdrowia, od pacjenta, lekarza, opinioliderów, WHO, chapeau bas, stworzyło nam pewne rekomendacje, ale takie muszą być lokalne, narodowe. Każdy ma coś do zrobienia.
One example from Romania is that, yes, energy consumption is a big deal. So what they're doing in pilot projects is they're trying to reduce energy consumption, the loss by energy efficiency strategies and projects, and increase the use of renewables. But it should not stop at that, of course. And the other thing from the private sectors, and that can be extended to the public sector very well, is publishing the sustainability reports, bringing more transparency for these entities, public hospitals, public institutions. Transparency will then drive action.
Patient organizations have a critical role in ESG through their whole life cycle to raise awareness, the importance of this topic, and also stress to each and all stakeholders that it has a direct effect on respiratory patients' health.
That industry is simple animal. So if we would like to go bottom up, I still agree this is a really good approach. If there are companies which are actively doing more than others, just don't be scared to promote them, to appreciate them, to give them slightly bigger reimbursement, to really just don't speak about the money now, but about the investment for the future, because everything we are investing now into better environment will be back in 10 years, maybe, okay, 15 years, okay, 3-4 political cycles, but anyway, we are the society and we should think about it in the long-term perspective.
If I would say that ESG is not an add-on to health. It is the operating system, as Natalia said, of the of delivering health that is equitable, that is resilient, that is also sustainable. And by cutting pollution, by creating greener care pathways, and building climate-ready hospitals, Central and Eastern Europe can protect its people now and the future.